Please describe the operations and batch processing at your facility prior to COVID-19.
We service about 800 inpatients on a regular basis. Our internal compounding is a pretty active operation to support our patients. Over the last few years, we've sort of transitioned to doing insourcing of most of our things that we had previously purchased from different vendors in order to maintain our own quality control, and also as a cost containment issue. We average about a $2 million savings per year by re-insourcing that compounding business. So it's been something that's worked really well for us for the past few years.
How has your facility used the Assure-Trak compounding management system to improve the operations and batch processing at your location?
Having excellent batch records has really helped us to be more compliant from a regulatory standpoint. It's helped us manage our workflow and understand where our products are being used and at what rate. Especially during back order situations, it's really allowed us to do some proactive management of items that previously we struggled to maintain and still provide excellent care for our patients.
Please describe your facility's operations for the COVID-19 vaccine preparation and management.
Our facility opened a clinic to provide COVID-19 vaccines, starting with healthcare workers, but I'm extending now to some of the public back in the beginning of January. And currently we are doing about 1,200 doses per day. It's a very multidisciplinary team of nursing, physicians, med students, and pharmacy that are providing the vaccines. And we've got a team of pharmacists and technicians who are preparing those vaccines for administration. One of the things that we felt like was important for our site, especially having two different vaccines with two different doses, having the pharmacists and technicians kind of managing that process rather than leaving it up to those giving the administrations, we thought that would be a little error prone. So we've kind of owned that situation, and it seems like it's working very smoothly for us.
How has the Assure-Trak compounding management system assisted with the COVID-19 vaccine preparation?
Assure-Trak has really helped us manage our vaccine preparation and distribution in several ways, not the least of which is the labeling function. So we're able to clearly label the doses. It's been especially important for us as we've had multiple brands in the system on the same days to be able to have those visually different with some color coding. It's really helped to make sure that the patients are getting the correct vaccine that they are supposed to get, especially on that second dose. We've also had a number of times when our state's system where we're tracking all of this information has gone down for a little bit of time, and we've had to transition to a paper documentation system. And as always with paper, it's error prone, and we've had even several days later where a lot number perhaps was left off of the documentation. Having the batch records in Assure-Trak, we're able to go back and reliably be able to provide the information to backload that information into the electronic system for the state. So it's much smoother than having paper records to be able to accurately pull up those lot numbers and get that documentation corrected.
What has been the impact of the Assure-Trak compounding management system for managing the overall vaccine rollout at your facility?
Besides the ones I've already mentioned, having the batch compounding record has been very advantageous to us. We feel like it's important to be able to track each step of the process. So having the lot numbers of the vaccines and the lot numbers of the diluents when we've used those has been very important for us to be able to maintain and retrieve those records. It's also helped us manage the workflow, knowing how many doses we're going to be having each day, to be able to track that over time to see what sort of staffing we might need to support our clinic. It's a pretty big operation running a clinic 12 hours a day, 7 days a week. So we utilize that data to be able to staff that adequately to make sure that we have the doses ready as patients arrive.
What has been your experience working with ConsortiEX to set up the Assure-Trak compounding management system for COVID-19 vaccine workflows?
So we at IU Health have had a long history with ConsortiEX and been recipients of great customer service. The COVID-19 experience was no different. things happened very quickly. I'm sure that's true in every location across the country. But we got vaccine in, and we're ready to start administering, and realized that the product wasn't something that was built yet, and because it was released so quickly. We put in a call to our colleagues at ConsortiEX, and they had that resolved within 6 hours. It was a great turnaround time and allowed us to open our clinic within hours of receiving the drug that we've been waiting for so long.
Based on your experiences using Assure-Trak and building new workflows for COVID-19, do you feel more equipped to manage future emergencies?
So this has been a really eye-opening experience for us at IU Health in terms of being able to be very nimble and provide a service that was sort of unexpected, while still maintaining, our regular business operating, taking care of patients. Using Assure-Trak has given us some opportunities. We realize we can kind of play with it, use it for different things. We've been creative and used it for some drugs that are in the investigational stage for treating COVID-19 patients. And having all of those abilities to maintain those records in one central location has been a big advantage. I think it's really prepared us for the future to understand what our capacity is to do unusual things. And so we feel well positioned for the future, whatever that may be.